Okay, let's talk about the RH antigen. Remember we discussed that you had the possible antigens. Good. Possible antigens on the RBCs were A, B, or RH antigens, okay? Now, usually, if you are, say, a blood type A, you would have an anti-B. And if you're a blood type B, you have an anti-A antibody, but the RH usually is not included immediately because the RH antigen is a bit different. So here, first of all, around 85 to 95% of the population is RH positive, which means they're either O positive, A negative, sorry, A positive, A positive, or B positive. It's positive is very common. And these people usually do not have, well, they cannot have an anti-RH antibody because then they would attack themselves. But even those who are RH negative, these also do not have an anti-RH antibodies, okay? Because in this case, you only can develop anti-RH antibodies, only develop anti-RH antibodies if you have been exposed to the RH antigens, okay? And this can lead to some complications, especially during pregnancies, all right? So let's look at that example as to when this may be a factor. So again, you only will develop the anti-RH antibodies if you've been exposed to the RH antigen previously, either through blood transfusion or in this case, through pregnancy. So let's see how it affects pregnancies. So here, this is called the hemolytic disease of the newborn, HDN. So in this condition, HDN, hemolytic disease of the newborn, hemolytic disease of newborn, HDN here. So on the first pregnancy, okay, you can say, let's say example will be an A negative mother has a positive baby. So this is the situation here. So this is the mother. She's A negative, which means she has anti-B antibodies inside of her blood. She's carrying in her uterus a positive baby. Okay, fine. So here, so she doesn't have the RH antigen, but the baby has the RH antigen. So near the delivery time or near term, the baby's blood can sometimes mix with the mom's blood. So here, the baby's A positive blood crosses the placenta, or at some point blood mix with mother. So now the A positive blood leaks into the mother's blood. Remember, she's A negative. Okay, and that small leaking across will then cause the mother to develop anti-RH antibodies. So now, after this is the exposure. After the exposure, the mom now is still A negative, but now she has anti-B and anti-RH antibodies because she's been exposed from the first pregnancy. And now the baby, of course, is gone. The baby's already delivered. The baby's out. So that's the first pregnancy. Now on the second pregnancy, now mother again is A negative, and baby again can possibly be again, maybe it can be O positive, or even let's make it again A positive. But now mother has in her blood anti-B Rh antibodies. And then that antibody will cross over the placenta to enter the baby's circulation to attack the baby's blood. All right? And that's a complication. So in case first pregnancy, a negative mother with a positive baby, right? Step 1, step 2, baby exposed mother to Rh antigen. Step 3, mother develops anti-Rh antibodies, and then in second pregnancy with a positive baby, mother's antibodies will attack baby's RBCs. Okay, this can lead to clumping, what's called agglutination, as well as blocking blood flow may be compromised. All right. So, and the idea of agglutination is this. So if this is your typical RBC like this, right? When they're flowing through your blood vessels, when they come here, when the blood vessels narrows down, they can go through one at a time, like this, single file, through the narrow capillaries. When you have agglutination, so here the RBCs are now clumped together by antibodies. It's called clumping, okay, agglutination. And then when that starts to try to flow through a narrow capillary, they cannot get through. So blood flow is compromised downstream because you're agglutinated, you're clumping the blood together from the reaction with the antibodies. All right, so mothers get it this way, but males can also get it. Males can also get anti-Rh antibodies from a blood transfusion. If you give the male the wrong blood type, if for example the male is A negative, you can give it the A positive blood type and you'll be fine that first time around. But then if he needs a blood transfusion again and again get A positive, then that's a problem, because after the first exposure, he will develop anti-Rh antibodies and wait for the next exposure to it to then attack it. Okay, we'll pause there.